What the price are true, yes, yeah. Yes, sir. Have you seen? Okay. Patience, God bless you. That's all your heart desire. Lift you higher. Come on, what do you think about it? I don't know. Ha.
Good afternoon, ladies and gentlemen. Hello. Hello, good afternoon, ladies and gentlemen. Can we please have you seated? Good afternoon, ladies and gentlemen. Could I please...
We are about to start.
Hello, can I please ask you to kindly take your seats? We've been told that the VP is slowly making his way here, so we'd really appreciate if you could all take your seats. Thank you, and thank you all for making it on time today. It's really a pleasure to see all of you here with us this afternoon in preparation for our formal launch of the Lancet Commission report.
the internet now connect music. Connect music.
Once again, good afternoon, everybody. I wonder how many of you have started some advanced reading of the Lancet Commission report? Who's gotten ahead and started reading the report already? I think you'll find there are a lot of insights. I think a lot of us here are important stakeholders in the health sector. And as you can imagine, with this type of commission and this type of report, a lot of work has gone into putting it together. So I think, over the next few months, etc., within your existing organizations, departments, you now take this time to take in a lot of the recommendations and findings. I think all of us, one nation, one health. A lot of us care deeply about the health sector, as you know, as a result of COVID. No matter what we do, if you do not have good health, then the work isn't much, which really is, why this kind of commission, this type of report is really, really welcome at this very moment. So I'm sure that you will all start your advanced reading of the commission report, so that as we're going through it today, we're already familiar with some of the issues that have been highlighted. So it's in advance of that, once again, thank you. I know usually we have these types of meetings early in the morning, but we know that our leadership have very, very busy schedules. So we've moved it to later this evening. So despite that, we're exceptionally happy that many of you have still taken that time to come this evening and to really listen to what has been done and to listen to some of the findings from the commission report. So just to welcome you. Thank you. So once I get the signal that our Vice President is on his way, then we will start this by standing for the national anthem, as is very much protocol in Nigeria.
Better. Because Ibuku live. I've sent it to you. Sarah, Sarah. So we don't need to add that. They can, because I'm not sure people can still register, so they can click on that link, our link, to watch on YouTube or Facebook. Eh? I don't. Yeah, we'll come that. It's our tweet that it does. It's our tweet that it does. Tweet that says that.
Recording in progress.
Hello, good afternoon. Could we please all rise? Cue the national anthem, please. Please, can you all be seated? Thank you very much. Thank you, everybody, and welcome to all our distinguished guests. Welcome to the launch of the Lancet Nigeria Commission report. Please help me in welcoming His Excellency, the Vice President of the Federation of Nigeria, Professor Yemi Osinbajo. We'd like to also welcome the Secretary to the Government of the Federation, Boss Mustafa. I'd like to welcome Dr. Morenike Alex Oko, the Director of Public Health, who is here on behalf of the Honorable Minister of Health. We'd like to also welcome the WR for the WHO, Dr. Walter Kazidi Mulumbo. Welcome. We'd like to also welcome the Assistant Director General of the World Health Organization and the Lancet Nigeria Commission, Dr. Chikwe Hekwazu. And would like to also welcome and acknowledge all the heads of the parastatals, Dr. Ifedayo Adetifa, the Director General of the Nigeria Center for Disease Control, Dr. Faisal Shuaib, the Executive Director of the National Primary Healthcare Development Agency, Dr. Gambo Aliyu, the Director General of the Nigerian National Agency for the Control of AIDS and also Nigerian Commissioner, and Professor Mohammed Nasir Sambo, the Executive Secretary, Chief Executive of the Nigeria Health Insurance Scheme. We'd like to also welcome Kathy Wimp, who is Operations Manager and Acting Country Director for the World Bank here, standing in for Shubham. And we'd also welcome Dr. Betta Edu, who is our Honorable Commissioner for Health for Cross River, and also the Nigeria Health Commissioner, Head of the Nigeria Commissioners Forum, representing the National Council on Health. And of course, we want to also welcome our commissioners for the Lancet Nigeria Commission report. We welcome all of you. We know we have a team who are here from London, so welcome to this event, and thank you all for being here today. We also want to acknowledge and welcome a lot of our guests who are joining virtually. I think what COVID has showed us is we're able to broaden the reach of our events by also welcoming our online audience. So this type of hybrid event is really great, so we can also include people who are not just in Nigeria, but our global Nigeria diaspora who remain very engaged in health. So as you all know, we are here today for the launch of the Lancet Nigeria Commission. It was a multidisciplinary group, was convened in London in 2020. And if you cast your minds back to 2020, there's a lot happening on the global stage in terms of, we were hearing about a pandemic. And this commission started really in January 2020 in London, where a lot of the thinking was going into how to now shape it. And it was led by Professor Ibrahim Abubakar, the Dean of UCL and Faculty of Population Sciences. And the team was really made up of a multidisciplinary group of experts from both Nigeria and the wider diaspora. And they came together really, bringing together the unique perspectives on the challenges, which we often talk about, but really also the opportunities to really rethink and reimagine health in Nigeria. So a lot of work has gone really into putting together the report, but the commission itself. And so it's been 2 years of really working together. And this was against the backdrop of what was happening. And throughout the putting together of this report, there's a lot of thinking that went into it. There were virtual discussions, really deep conversations, interrogating the evidence. I've been quite privileged to actually work with them at the very early stage. So really, today, all over the world, people are joining this event for the first detailed description of the Nigerian health sector. Looking at the past, looking at the present, and really forward-looking into the future of health in Nigeria. And the report was, as we can see, was published in a preeminent journal, The Lancet. While we welcome you to this event, the publication of this report really marks a milestone for generations to come. And it's a benchmark of where we have been and where we go to from here. Whilst the report, again, presents some of the challenges, as you will see when you read through it, but it also provides an opportunity based on the possible evidence, best possible evidence that we have available. So we welcome you to this Lancet Nigeria Commission report launch. We are all stakeholders in the future of health in Nigeria. COVID-19 really has shown us that health really has an input into every single sector we work in. And it's not just the responsibility of the health, of ministers of health, but we need to think about health in a multidisciplinary way. So other ministries, other agencies also that are not typically involved in the health sector, really also taking ownership of this report, and also the findings in it. So it will be disseminated quite widely over the next few weeks, months, and ongoing into the future. And as I said, we really need to have shared ownership of what are some of the findings in the report and where we go to from here. So we are extremely grateful to His Excellency, the VP, for being here. And we're also very, very happy to have all the key stakeholders who really were involved in the health sector, from heads of parastatals to commissioners represented ably by Dr. Beta Edu. And we'd like to also thank, of course, the Lancet Group and UCL for putting together this report. A lot of the commissioners that worked on this report, it was done pro bono and gave up a lot of their time. So taking this forward will be, a shared ownership. So we invite everybody to read the report in detail and engage with the findings. And, all of us have a stake in really contributing to the health future of Nigeria. I mean, we owe this to ourselves, and we owe this to future generations of Nigerians to come. So on behalf of my organization, on behalf of all the commissioners, I'd also like to say, thank you for joining us this evening, and welcome to all our distinguished guests. Just to start and set a context for what we are going to see in the report, we're going to show a very brief video presentation. In it, you will see two of our commissioners kind of share their insights into what were the findings in the report and how can we take this forward, and what really was the reason for putting together this commission. As you can see, we are ensuring that we include everybody in some of the findings for this report and also the dissemination. So there's also a sign language lady here who's also going to support in ensuring that this is all very much inclusive. So I'd like to please ask for us to cue the video presentation, and then we'll invite Professor Abubakar to share some of his insights into the report. Thank you.
Nigeria is a country of a lot of energy. If there's something I miss when I'm not in Nigeria, it's just that energy. You can't find it anywhere else. And I say that as a Nigerian who is sometimes critical. And with that energy comes a lot of imagination and a lot of potential to make change happen. One of the central core themes of this report that we are trying to encourage the country to think in terms of one nation, one health.
Gather 2 or 3 Nigerians in a space and we have a very sophisticated analysis of what is wrong with Nigeria. But on the other hand, there are lots of things that have actually worked in Nigeria. And we almost brush them aside and don't pay attention to it.
We eradicated wild polio in 2020. Guinea worm disease went from 650,000 cases in 1988 to 0 today. And we crushed the deadly 2014 Ebola outbreak in 93 days.
But when you also compare Nigeria to other African countries, one of the things that immediately strikes you is how relatively worse it performs on health compared to its neighbors, and compared to even countries that have less GDP, for example, than Nigeria.
Nigeria is the most populous country in Africa, yet the UN estimates life expectancy to be around 55 years old. The proportion of government spending on health was 4.6% in 2017, lower than the African average of 7.2% and the world average of 10.3%.
There is a lot of skepticism around, is universal health coverage possible in Nigeria? Where the fear of universal health coverage dissipates is when you think about the cost of not having it, which is really the cost we're bearing now.
Nigeria loses a lot by not investing in its people. And the way you invest in your people really is to invest in their health. As they say, health is wealth. Putting a lot of resources into health also means that Nigeria can capitalize on its vast human capital to generate the kinds of progress that it really wants into the future.
Sometimes I have people telling me that, well, because we're in Nigeria, we should be doing, for example, only implementation research, taking innovations that are made elsewhere and trying them out to see if they work in our setting. But I tell them, we also do discovery. I have the strongest students you can find anywhere in the world. They're really creative, they're really strong. Given the resources they need, they could really change the innovation space.
Not having Nigeria and Nigerians on the table is missing that kind of energy and that kind of imagination. It's like not having a country like the United States. For all its good and its ills, it's a heavily culturally influential country. And if Nigeria gets something right, a lot of the continent will get it right. One of the things Nigeria lacks fundamentally, and has lacked for a very long time, perhaps never had, is a deep sense of social contract between those who run the country and its citizens. And I don't think there's a better way to build that social contract than in the theater or avenue of health.
The health aspiration in Nigeria is not impossible. It's actually doable. There are lots of things that could be done that we know Nigeria can't afford. We didn't put them in the report. So there is a way for Nigerians to be healthier, and I hope people can take that away and use that with our optimism to actually build a better and healthier Nigeria.
I want people to feel that it is something owed to them by the government. Because you don't begin to make demands without a sense that you are owed the thing that you are demanding.
A huge part of healthcare is just maintaining health in people who are healthy. And some of that is led by other parts of society, the environment, agriculture, engineering, being able to get children the proper nutrients, water, sanitation, simple hygienic practices, immunization. These are all part of healthcare.
Here's what is possible. Are we willing to line up behind that vision? Because if Nigeria were to do that, to agree to a national vision on health, it's unimaginable the extent to which the success could be. When I think about this through, my imagination is that this could be the beginning of what Nigeria could be, really.
Okay, thank you. I think, watching that video, there's a much slightly longer presentation of this video, which is also available online, but this video is also available on the Lancet page and also on the YouTube so that you can all share it within your individual groups. But there really is a lot to unpack, I think, individually and collectively. There are many things that were raised there that we can all take on board. And it was very uplifting because what it does, it presents what is possible for Nigeria. And as Shea Bimbola mentioned, that social contract. How do you ask people to demand for something they've never had? So, future looking with this report, we're almost saying to Nigerians, this is what is possible. We all know the challenges, the past, the present. But in the future, we all know what could be possible if collectively, in our individual organizations and government institutions, we work together really to bring forth the findings from this commission report. Okay, so next on the agenda, just to crave your indulgence, there's a slight change in the program of events. His Excellency, the Vice President, will be giving his special remarks just before the moderation, or the panel discussion. But other than that, we'll be now going ahead with Professor Ibrahim Abubakar, who will tell us a bit more about the report itself and really share some of the insights that we really need to be taking on board. So we welcome Professor Ibrahim Abubakar to please give your presentation of the report. Thank you.
Thank you very much. Sorry, can someone put the slides up? Excellent, thank you very much. Okay. Your Excellency, the Vice President of the Federal Republic of Nigeria, Professor Yemi Osinbajo, the Secretary to the Government of the Federation, Mr. Boss Mustafa, the representative of the Minister of Health, members of the Diplomatic Corps, heads of government agencies, all protocols observed, ladies and gentlemen. It gives me absolute pleasure to stand in front of you to present to you the work we've done over the last 2 years to articulate what is possible for Nigeria. We've produced a report that is optimistic, but yet pragmatic, taking into account the realistic picture of what Nigeria can achieve. We titled the report, Investing in Health and the Future of the Nation, the Lancet Nigeria Commission. Can I have the next slide? Even compared to countries with similar incomes, Nigerian health outcomes are really dismal. We also have huge inequalities within the country, between geographical areas, between the rich and poor, and between different parts, urban and rural settings in the country. So we came together as a group of Nigerians always do, and we always have solutions. If I can go to the next slide, please. We always have solutions and articulate the problem. Whenever you put 2, 3, 4, 5 Nigerians in a room, they are busy discussing Nigeria's problems. And we thought there's an opportunity that us, as a group of Nigerian academics in our top universities and across the diaspora, we can think through those challenges and come up with a set of solutions that we would recommend. We purposely made sure that we were able to put together multidisciplinary perspectives, because the challenge is such that you just don't need health experts. You need political scientists, you need economists, and you need people from multiple disciplines, including law and anthropology, to come up with the right answers to the myriad of challenges that we face. We also engaged the Honorable Minister of Health as well as associated agencies right early in the process to get their support and sign-off so that what we do is policy relevant. We had a number of underpinning principles that guided our actions. Fairness and equity, which is fundamental to all of us. Pragmatism, taking into account what Nigeria is and what's possible. And evidence-based. We only put forward things that we know have been tested and will work. So our aim in setting out this commission is to chart a path where we reposition health policy in Nigeria to achieve health for all. And our vision is to provide recommendations to ensure that the health and wealth of future generations of Nigerians is enhanced, and therefore Nigeria can fulfill its full potential. The process we undertook to develop our report is iterative and inclusive. So with extensive engagement of stakeholders, we looked at the published literature, we collected data extensively from our hospitals, from the community, and from the national level. We analyzed and synthesized those data. We undertook a number of case reports looking at successful examples within the country, but also internationally in comparable countries. To get buy-in from people, we consulted extensively, and where we couldn't reach a decision, we used a Delphi process to help us approach consensus. We then put together, analyzed the data, and wrote the report. Unfortunately, COVID hit, but in parallel, we carried on supporting the Nigerian government response to COVID-19 while continuing with the work. We ultimately ended up submitting the report to the Lancet. We had appropriate international scrutiny and peer review, and we're delighted that it was finally accepted for publication, and that we're able to come and start the first step of engaging. So I'm going to talk about now very briefly about the challenges, the opportunities, and then most of what I would say would focus on the next bits, which is the recommendations. So starting with the challenges. So Nigeria is by far Africa's largest economy. We know that. We are the most populous country. But sadly, wealth does not always equal health. We've heard that we live on average at birth 55 years. We have more kids under the age of 5 dying in this country than any other place in the world. And our maternal mortality ratio is only better than 3 countries, Chad, Sierra Leone, and South Sudan. Our health system suffers immensely from the historical legacy that our colonial masters presented, so that it's hugely focused on curative care, which limits of it, and insufficiently on prevention. And we think that there's an opportunity to correct this. Primary health care ought to be the focus, but the multiple crises that affects the delivery of policy has made that really challenging. In terms of health policy, we're ill-adapted to these preventable causes of ill health. The major causes of death in Nigeria still remain infectious causes, conditions that affect kids and pregnant women, And we do have a growing burden of non-communicable diseases affecting older individuals, as well as diseases of epidemic potential. So to solve this issue, we need to focus on the risk factors that underpin the occurrence of these diseases, including safe water, sanitation, nutrition, and the usual things you'd expect, which require that health has to be in all policies, and health can't just be focused in hospitals. Of course, we have a rapidly growing population, and that our health system must evolve to deal with the consequences of this rapidly growing population. There's huge variations in the rate at which the population is growing across the country, and our interventions in population health must address those inequalities across the country. The impact of policy reform to date, and there are numerous excellent documents, has actually been limited, in part due to governance issues and accountability roadblocks, and I'll come back to these in our recommendations. The number of excellent initiatives, including the formal sector health insurance scheme, the primary care under one roof, or the new reimagination of that is currently going on, the 2014 Health Act, the Basic Healthcare Provision Fund, are all good starting points, but they are not being implemented because of a number of complex issues, including insufficiently specified governance mechanisms, lack of accountability, and challenges with sustainability, where especially they are donor funded. Therefore, the health system is not really meeting the challenge of our health needs. Sadly, healthcare is also predominantly financed out of pocket. 78% of health expenditure comes out of pocket, which means the poorest Nigerians end up with catastrophic expenditure, and this is something we can deal with. Donor spending is also uncoordinated. We, Nigerians, should be telling people trying to help us how we want them to help us. Compared to our neighbors, if you look at the statistic, we have an accompanying Lancet paper that looks at this in great detail. And sadly, even when we compare to countries that are poorer than us in terms of life expectancy and the number of kids dying, we actually do poorly. This says to me that there's an opportunity to spend the money we spend better, because we are spending more than they are and we're not doing as well. But there is also an opportunity to do more by spending more. So I'd now like to talk about, because it's not all doom and gloom, the opportunities that exist that we should be building on. So firstly, some progress has been made, in particular around mortality. Over the last decade, 2 decades, mortality has dropped year on year in Nigeria. Fewer people are dying. Life expectancy has increased by about a decade over the same period, and there's a lot less disability. Excellent initiatives such as the Healthcare Provision Fund and the health insurance schemes in the federal government and the state are all good starting points towards what we need and must do, which is increase coverage in the health system. There are also numerous examples of success in communicable diseases. We dealt with Ebola. We tackled COVID-19 adequately. We dealt with Lassa fever and monkeypox repeated outbreaks. We can do this. Nigeria was able to conduct the largest and most complex HIV survey with hundreds of thousands of people on time and on budget, and now we know how many people have HIV in Nigeria. We were able, despite all the skeptics, to get to a point where we are certified of being wild polio free, a significant achievement which we must build on. So I'd now like to move on to our recommendations, which is the final part of my talk, and there's quite a few of them, but I'll crave your indulgence and I'll go through them as rapidly as I can. So the first one relates to, given our young population, prevention really ought to be at the heart of health policy. The case for this is absolutely clear. All of our modeling and analysis suggests for little amounts of money, as little as 400 naira, you can get several-fold the benefits in interventions such as better cooking fuels, better nutrition for our kids, and access to contraception. You can multiply the benefit several-fold. This makes the case that health really ought to be in all policies. We also need to make strong investments in public services to create a healthy population, and this has to be multi-sectoral. We have to get government functioning properly with funding, governance, communication, and accountability. We need to empower that in all settings, we have a place-based approach to deal with this wider determinants of health, and that there ought to be functional health units in every level of government. We make this case that we must rationalize services at the federal, state, and local level. And our idea, a big idea in this space, is there are instances where we need more centralization in terms of getting the right standards for quality, for surveillance, for health information systems, in terms of pooling resources and being able to purchase services better, and in terms of redesigning the supply chain using pull and push mechanisms. But at the same time, we need to have deliberate localization of implementation, not least in how we train workers to collect and use data, in how we define health services so that they align to local risk if each part of the country and each population, in how we tailor according to local modes of community service delivery and sociocultural norms. We must also leverage the strengths of the private sector. The COVID-19 response, including interventions by CACOVID, has shown that we are able to do things more rapidly while we appropriately use the private sector. We must get the organized private sector to produce the health products we need: vaccines, drugs, diagnostics, and consumables. And we must think through how we use strategic financing to be able to govern the private sector appropriately so they benefit our citizens. We believe that to improve health information systems, digitization is the key, and it is good value for money, and our modeling demonstrates this. Despite concerted efforts when we are collecting data, we find numerous gaps in our health systems. We know for a fact that if we get the systems right and digitize our systems, then we can do things more efficiently and deliver better care for our people. We therefore recommend setting up national standards for digitizing using existing technologies and systems to deliver this innovation for our people. Healthcare workers, strikes, difficulties in recruiting people to primary care are huge challenges. We must get that right and get people to staff our primary healthcare centers. We urge that the federal and state governments work jointly to develop specific implementation strategies to retain staff with proper career structures for all health professionals. We need to work with the regulatory bodies so that states are able to engage with them and that individuals that work in the health system are able to track how many people are in the workforce, and licensing is made easier. And we think that the federal government, especially through the Ministry of Education, should work to identify the manpower needs and train more people of the right type. So, the adage that health is wealth, which I said earlier that may not always be true. Actually, health is wealth if you align your investment case with political incentives and pull on the appropriate levers of accountability. Our recommendation is that health, building on the Basic Healthcare Provision Fund, should have ring-fenced budgets that can go between administrations. We think that subsidies that are inequitable, such as petroleum subsidies, ought to be spent on healthcare. We also think that we should have government mandating health coverage for the poorest Nigerians, the 83 million poor Nigerians who cannot afford to pay that premium. Government should pay for that through innovative financing and raise new revenue to do that. Today, we will need 1.2 trillion naira, 9% of the current budget, to cover all those individuals. It is doable if we have the will. We model the benefits of these investments in detailed models that are able to show you that actually you don't need a lot of money per capita to make a difference. For the meager sum of about 5,000 naira spent per individual to 2030, you could be saving about 100 million kids from dying and about 160,000 pregnant women from dying. If we are ambitious enough to multiply that fivefold, we can get to a level where we are saving millions of lives within Nigeria. To raise financing, we must increase the fiscal space. It's not really optional, but we must also increase the efficiency of our spend. Think about new ways to raise revenue, which is doable because others have done it. We need to think about how we do strategic purchasing so that smaller parts of the health economy are not exploited by providers and that we can get more efficiency and value for our money. And we must find a way to wean ourselves of donors. We can't have a situation where donors tell us what to do. Nigeria should be telling the donor community what would help our people. We are the giant on the continent. We have to be in the leadership role for innovation. We heard my colleague, Professor Iruka Okeke, speaking earlier at the University of Ibadan about how much science they can do. We should take our rightful place and lead science across the world and on the African continent. We therefore recommend that a National Medical Research Council with 2% of the budget is established that would do high-quality global innovation and deliver for our economy and for the health of our people. We must invest now if we are to reap the benefits of the huge demographic dividend that is imminent in our huge population. If we don't, the consequences are severe. I'd suggest female education is probably the single thing that we could do to make that huge difference, and it will consequently have effects on health. The investment needs to happen now. We think the way to do it is, as Dr. Shea Abimbola was alluding to earlier, we call for a concept of a one nation, one health approach, a new social contract between our leaders and our people that says this is what Nigeria would do for you. And in return, we expect that there'll be a lot more patriotism and we'll all buy into our nation and have a proud future. Thank you very much for listening. If you want to see the report, you can pick up copies online. There are versions available. We also have a lot of individuals to thank, including the numerous groups that work on the report that are not co-authors and our funders. Thank you very much again for listening.
Thank you very much, Professor Abubakar, for that overview of the findings from the Lancet Commission report. I think what you have done is help distill a lot of what is in those reports. There's quite a lot to take in, and I think through your presentation, I think you've shed light in highlighting some of those recommendations and findings that we all need to be thinking about. And I think especially at the very end, the notion of one nation, one health. We know we are one nation, and we are one health, because irrespective of how well we are one particular day, our health is collective. Health starts in the communities, health starts in the rural areas, health starts in the cities, health starts everywhere. So critically, one nation, one health, I think really is the mantra in how we reimagine our health sector, in that unified purpose, in really thinking of how we drive improvements for all of us to benefit now and for our future generations. So thank you ever so much for that presentation. Would like to now please invite the Honorable Minister of Health, ably represented by Dr. Alex Morenike Oko. Sorry, Dr. Morenike Alex Oko, apologies for mix-up. Just to give your brief remarks, given what we've now heard and what this means for you. Thank you very much.
Your Excellency, the Vice President, Professor Yemi Osinbajo, the Secretary to the Government of the Federation, Mr. Boss Mustafa, Dr. Betta Edu, representing the Honorable Commissioners for Health, senior government officials here present, the World Health Organization country representative to Nigeria, the Assistant Director General, WHO, Dr. Chikwe Ihekweazu. Please permit me to align with already established protocols. I have been directed to represent the Honorable Minister, who is unavoidably absent, and I will be reading a very brief goodwill message on his behalf. I'm delighted to be here to give this goodwill message, and I'm particularly delighted that this report has been written by Nigerians for Nigeria. It is not only a diagnostic report, but also an advocacy statement, which in summary requires that government must see health as a social contract and strategic investment in order to ensure universal health coverage, eliminate catastrophic out-of-pocket expenditure, and ensure the mainstreaming of health into all policies. Professor Ibrahim has eloquently taken us through the recommendations in his overview. Ladies and gentlemen, Your Excellencies, achieving UHC is not negotiable. 2030 is only 9 years away. Therefore, we have a daunting task ahead of us to achieve universal health coverage by then. We must engage with the findings of the Commission, and all hands must be on deck to ensure the implementation of the recommendations and to address the myriad of challenges hindering the achievements of universal health coverage. In conclusion, achieving universal health coverage is a task that must be done. So help us God. Thank you for listening.
Thank you very much, Dr. Alex Oko, for your remarks on behalf of the Honorable Minister of Health. I'd like to please recognize the distinguished Chairman, Senate Committee on Health, Dr. Ibrahim Yahya Oloribe. Good evening, sir. We welcome you. We know you're one of the key advocates and champions who really has been pushing in really improving our health sector. So pleasure to welcome you to this launch of the Lancet Nigeria Commission report. So really, now that we've heard from Professor Ibrahim and also the remarks from the Honorable Minister of Health represented by Alex Oko, we'd like to give a special welcome and special recognition to the Vice President, Federal Republic of Nigeria, to please come and give your welcome, your special remarks on behalf of the government, and also to share some of your thoughts on the Lancet Nigeria Commission. Thank you, sir.
Your Excellency, the Vice President of the Federal Republic of Nigeria, Professor Yemi Osinbajo, SAN, GCON, the distinguished Senator Ibrahim, who is the Chairman, Senate Committee on Health, the Commissioner for Health, Rivers State, and also Chairman of the Forum of all commissioners, heads of agencies and departments here, members of the Lancet Nigeria Commission, distinguished ladies and gentlemen of the press. I am delighted to be with you today at the formal launch of the Lancet Nigeria Commission report, Investing in Health and the Future of the Nation. Our country is at an auspicious time, and as we emerge from the challenges of the global COVID-19 pandemic and the uncertainties of a less secured world, as stated in the report, now is the time for Nigeria to step up and take its deserved position in the world. This can only be achieved with a healthy population driving a healthy economy. The COVID-19 pandemic has demonstrated what Nigeria can achieve with political backing and effective coordination. The impact of the COVID-19 on the economy has been significant, and several thousand Nigerians lost their lives and their livelihoods. Yet Nigeria has been relatively spared the devastating effects of the pandemic. We have been able to harness considerable resources, building on our partnership with the state governments, the private sector, the donor community, to contain the pandemic using evidence-based public health measures. The lessons from this experience are yet to be fully studied. However, we know that Nigeria has not seen the expected returns from increased health investment over the years. We have an inadequately resourced health system, decaying health infrastructure, and significant out-of-pocket health expenses for our citizens. As we emerge from the pandemic and move on to recovery, we are very much aware of these challenges. Our growing population requires increased investment in health to achieve the desired goals of a healthy population, but such investment needs to be efficient, evidence-based, and sustainable. To this end, we must learn from our multi-sectoral approach to the COVID-19 pandemic. The set of investment strategies proposed by the report are aligned with underlying principles that the PSC, then PTF, COVID-19 adopted and implemented over the last 2 years. Prevention coupled with the rational use of resources will go a long way towards improving the health of our people. Before I conclude, let me make this statement. I honestly believe that we need to invest in the health and the future of our nation. But as an outsider who got thoroughly involved in the health sector as a result of my appointment as the chairman of the then Presidential Task Force on COVID-19, now Presidential Steering Committee on COVID-19. I have come to learn that in spite of the weaknesses of our systems, the strength of the systems in other democracies, COVID-19 did not respond to money. It responded to science, facts, and strategic planning. And I think going forward for our country, whatever resource we make available, without a strategic change in the health infrastructure in this country, it would amount to a total waste. There is need for a surgical change in the health infrastructure. You can throw whatever amount of money you want to throw. If this system remains the way it is, the end product would not be of any benefit to the people of Nigeria. So as experts, I want you to look at what we have in place as our health infrastructure today and see how to transform and revolutionize that health infrastructure so that it is responsive to the needs of the people before we begin to throw money into it. If the pandemic of COVID-19 was to respond to money, USA would not have lost over 1 million of its citizens, higher than any of the wars that they have ever fought. Finally, I congratulate the Lancet Nigerians for Nigeria. I look forward to reviewing the report as an additional resource in the country's journey towards a healthier future for our citizens. I thank you for your kind attention.
Thank you ever so much, Mr. Boss Mustafa, Secretary to the Government of the Federation. If I crave your indulgence, I'd like to please also add another applause for your exceptional leadership as the head of the Presidential Task Force, for always being there. I know for many of us, just watching every evening the Presidential Task Force, all the other ministers and leadership on that group, just hearing all of you every evening reassuring Nigerians about this pandemic that was causing so much havoc in our lives. So I'd like to create my indulgence and thank you once again for your exceptional leadership in leading that group. I think many countries around the world had a lot to learn about what we did in Nigeria, and I think a lot of lessons we can share. We always talk about the negatives in Nigeria, but I think there are also a lot of positives that we learned through that. So once again, thank you, sir, for that. I'd like to please welcome the Vice President of the Federal Republic of Nigeria. Thank you ever so much for always being there and for your exceptional leadership as well. To give your special remarks on the Lancet Nigeria Commission, we're very proud to have this commission for our country, so we really look forward to hearing some of your remarks.
Distinguished Senator Ibrahim Yahya Olori, Secretary to the Government of the Federation, Mr. Boss Mustafa. The Honourable Minister of State Health, represented today by Mrs. Morenike Alex Oko, Assistant Director General of the World Health Organization, Dr. Chikwe Ihekwazu, Lancet Commissioner, this is an important work, an important report done by, we're told, a group of Nigerian academics and health policy experts from our top universities and Nigerians in diaspora. The report is aptly described as a report by Nigerians for Nigeria. And the report established, in my view, and did so indisputably, the linkage between health investments and the socio-economic development of our nation. To this end, the report proposes a new social contract centered on health to address Nigeria's need to define her relationship, or the relationship between the citizens and the state. And the further recommendations that prevention has to be at the heart of health policy, given Nigeria's young population, and requiring a whole of government approach and community engagement. The whole notion of one nation, one health policy to attain universal health coverage, which would, we're told, particularly benefit those segments of the population bearing the highest disease burden. An ambitious program of healthcare reform to deliver a centrally determined, locally delivered health system, including providing health insurance for 83 million poor Nigerians who cannot afford to pay health premiums. A health system that encourages innovation and engages communities to ensure that existing nationally driven schemes have local buy-in and are sustainable, and also reforming the policy and regulatory landscape to unleash the market potential of the private sector. Then a whole system assessment of the investment needs in Nigeria's health security, in which the pandemic, and I think the pandemic has exposed those particular weaknesses. We now can tell what those weaknesses are, and in order to redesign and rethink our health security needs, I think there's enough that we know now, and perhaps more than ever before since the pandemic. And also that government should lead the development of standards for the digitization of health records, better data collection, registration, and quality assurance systems. And I believe that this objective of a new social compact is important if we're even to meet the constitutional guarantees that we've sworn to encapsulated especially in the right to life to our citizens and the primary aspiration of the fundamental objectives of the Nigerian state, which is the well-being of the Nigerian citizen. So I think the report captures what it is that must motivate government to be more concerned about health policy, and especially to place health policy at the center of the social compact between the Nigerian citizen and the state. I must say that this government has placed great emphasis on advancing the health of all Nigerians. We put primary health care at the heart of our reform effort, which ensures that basic healthcare services of high quality is delivered to Nigerians irrespective of where they live in the country. And we believe that the health of Nigerians does matter. And we've therefore focused interventions on the people living in the rural areas, women, and of course, vulnerable populations. Of course, there's no way by which we can say that we've done enough or nearly enough. The challenges are there for us all to see. And I think the report underscores those challenges and, of course, puts all of the responsibility where it ought to lie. But we welcome innovation and fresh thinking to further improve Nigeria's health outcomes. And I think this report provides a number of excellent recommendations, some of which are already being implemented, but many of which we will have to carefully consider. The timing of the publication of this report is important. And I think it is particularly apt because Mr. President has just inaugurated the Health Reform Committee, which he's asked me to chair. And the committee, I believe, will benefit immensely from the input of the experts who authored this report, and in fact from the entire report itself. The need to provide our people with universal health coverage led to the enactment of our National Health Act 2014. Based on this important legislation, this government, and I believe future administrations, are well placed to expand coverage and provide the much needed health care. So I want to thank our health minister and, of course, all the health officials for the hard work, and we've heard also the extremely commendable work that the task force on COVID-19 did, which I think displayed our public health system in the best possible light and has shown that we do have a robust public health system, and that, yes, it needs some tweaking here and there, but that we're quite prepared for the challenges of the future. Government, the federal government, will continue to promote the welfare of all in the health sector. And I must say that also that we're extremely grateful to the commissioners who authored this report and to the Lancet, who have provided their global platform to publish this report. It is therefore my very special pleasure and privilege to formally launch the Nigeria Commission report, Investing in Health and the Future of the Nation. Thank you very much.
Thank you ever so much, Your Excellency, the Vice President of the Federal Republic of Nigeria. And thank you so much for coming to launch this very, very important report. I like the One Nation, One Health. I think we can all keep on repeating that, as it is a unifying message about the importance of prioritizing health and the importance of all the things that we know we need to do to improve the health sector. As I mentioned, there is a slight change in the order of the program, as you would have noted. And we've been informed that His Excellency may need to leave shortly. So we would like to take some group photographs. And I'd like to please invite our distinguished guests, the heads of the parastatals, the WHO, the Assistant Director General of the WHO, the representative of Ministry of Health, Dr. Osage Ehenire, Dr. Alex Oko, to please join us on stage, as well as Professor Ibrahim and Dr. Aliyu, and of course, the Secretary of the Government of the Federation, Mr. Boss Mustafa. And also would like to invite, of course, your distinguished Senator, Yahya Oloribe, take a group photo before the VP needs to leave us today. Thank you so much. Could we please have the national anthem? Thank you very much. So please, could we have the national anthem? The event now continues once the VP leaves with the panel discussion. Thank you.
Hello.
People to sit down now.
Yes. Hello, could we please be all seated so we can continue and move to the next item on the agenda? We have quite a few things we want to get through. Could we all please be seated? Thank you so much. All the teams, all the people standing in the aisle, if we could please be seated so we can continue with the next item. Okay, that's fine. Yeah. Okay. Okay. Could we all please be seated? Thank you so much. We'd like to move on to the panel discussion now. I think we've heard a lot so far of the findings of the Lancet report, but now it's time to digest some of what we've heard. I'd like to please invite the distinguished chairman, Committee on Health, Dr. Ibrahim Olori, to please and introduce our panelists for the next session. So, the distinguished chairman, if we could please have you come up to introduce the panelists. Thank you, sir.
Good evening, distinguished colleagues, ladies and gentlemen. Let me just say I align with all the established protocols, and more particularly because we are going to scientific sessions, so there will be no all the political niceties which will be discussed, isn't it? So if I'm excused like that, so I will proceed straight away. I've just been drafted to perform the role of inviting our panelists and the moderator for the panel discussion, which will be very essential for us to have a better understanding of the report as we read it after today's launch. So I have the privilege and honor to introduce colleagues and brother, Dr. Sani Aliyu, who will be moderating this session. I'm sure all Nigerians know Dr. Sani Aliyu, doesn't it? Because with COVID-19, if you don't know him in Naka, you know him with COVID-19, isn't it? So Dr. Sani, you are welcome. And I'm pleased that the panelists is gender balance and affirmative action is far more than represented. So the next person I'll be introducing is Professor Iroka Okeke, a professor of pharmaceutical microbiology at the University of Ibadan. So, Prof, you are welcome. So I'm not reading all the details because this is already distributed in the program. And my lost but found friend and colleague, I've not seen him for years. Where is he? Obina. So he's dressing differently today. We work quite a lot since the last 20 years ago in a lot of researches and writing some of the policy documents. So Professor Obina Owujekwe, you are welcome once again. At the fourth, but not the least of the panelists, is Professor Eme Uwaje. She is a public health physician from the University of Ibadan. Prof, you are welcome. I will have the privilege once Professor Uwaje takes her seat to hand over the microphone, or I think maybe the microphone there is working, to the moderator, Professor Sani Aliyu, to lead us in conducting this panel discussion. Thank you very much.
It's working. Yes, it's working. Thank you, distinguished Senator Ibrahim Olorigbe. I'll start first of all, since we're running a bit out of time, if I can just stand or sit on existing protocol, if that's okay. I'll start with Iruka. Iruka, I have two questions for you. The first one has to do with the burden of disease paper, which we've just published a fascinating paper, really. I would really encourage you to read it. So while we were doing the burden of disease paper, we realized that there were gaps in the data, significant gaps in terms of what is available. And I would like to know what are the opportunities to advance health information systems and disease surveillance in the short and long term. In other words, how do we fill in this gap, which is so essential when it comes to health programming?
Yeah, thank you so much, Sunny, and thank you everybody for coming for this launch. I think one of the things that was really important to us was to make sure that the report was based on evidence. And so it was really important to look at the data and understand the situation of health in Nigeria. And one of the things we found was that data is often looked at as a research substance, something that researchers collect to write their papers and their projects and so on. So data is not always there. Even when it is collected, the data are very, very difficult to access, even by the people who should be using them to determine what they need to do for their work. So data is something that allows you to know whether what you're doing is going properly or not. And one of the things we found was that health workers, actually, even those who are collecting the data, do not have access to the data. So I think it's really important for us to think about how to make data easier to collect, because it is work to collect data, but also easier to use for the people who are actually providing care or preventing disease. And it would really, really help if we use digital methods to collect and share these data. We already have some platforms that will make this possible, but they're inadequately deployed. And so we really need to use them to collect better data. The few data that we did collect, which is in this is the burden of disease paper. So I saw some people moving away and saying, I've got the report. No, you haven't got the report. This is the report. But it's an accompanying paper that actually shows you what we did find. And we were actually, at least many of us, were somewhat surprised to find that even countries that are spending less on health, or that have less to spend on health, are doing better than we are. And so if we keep a careful eye on the data, we'd be in a better position to know how we're doing and where the gaps are.
Thank you. Thank you, Erica. That's really very clear. I think what I'll do is I'll move on to Eme, and then we'll do another round at the end of the first run. So, Eme, our report argues that the adage, prevention is better than cure, remains true. And this is particularly important in a country like Nigeria, where we have such a large young population. What do you think are the two key opportunities to advance the prevention agenda?
Okay, thank you very much. I think the key opportunities are engagement with the various sectors that are involved. And there's some low-hanging fruits. Immunization. We have a really young population. And if we target immunization strategies, they're cheap. And we can save so many lives from using preventable, preventable diseases by addressing this and ensuring that people have access to these vaccines. Our immunization coverage is extremely low. It's actually abysmally low, embarrassing, like less than 30%. And as we've said, other countries that are not as rich as us actually have higher immunization coverage rates. So what can we do to increase this immunization coverage rate? The other thing that we could do is actually addressing nutrition. Nutrition for children is a key indicator of brain development in the first 12, 24 months of life. How can we engage other sectors and ensure that we have access, our children and our families have access to nutritious food? Our country, all over, you travel all over this nation, you see that there's food. Different seasons, there are different types of food. But there's also a high level of wastage. 70%, 80% of the food that we grow in this country is wasted. So how can we begin to engage other sectors and work with them to ensure that our children get access to the food that they need? So nutrition, immunization, two key. Thank you.
Thank you, Emma. So really, in other words, we don't need to spend a huge amount of money, Senator Olorugbe, to implement aspects of this report. All we need really is good food and Faisal giving us the vaccines. We'll now move on to Obina. Obina, as we're aware, you can't say government hasn't been increasing spending over the years. We have increased spending in health, maybe not to the level of the Abuja declaration. So is it really too little money, or is it inefficient use of money that is hampering our systems? Or is it both, as the commissioners suggest?
All right, thank you. Well, I think I'll use the MDGs and SDG context to answer the question. First of all, during the MDG, the country was awash with money from debt relief grant. We didn't achieve any health-related MDG. Nothing was achieved. So there was money, but nothing was achieved. But still, the country is still not putting enough money. The public funding is still very low. Citizens, 78% out-of-pocket spending tells you that people who are funding the health system are the people. Government money there is just to pay government workers who work in the system, and most times they are absent from work. So the citizens fund the health system. So which means you can actually scrap the government system and nobody will notice, because the funding comes from the people. But I think we need to look at it that even when the system is awash with money, we've seen millions of dollars, either as grant or as loan coming into the health system, and nothing to show for it. So it tells you that inefficiency is a big problem. Corruption is a big problem. People are feeding fat. Nothing is getting to the people. So once you have a system that is inefficient, corrupt, is not accountable, not transparent. So you can pump 1 trillion into this system. The SGF alluded to it. Nothing will happen the way the system is structured right now. So we have that problem of that no money will make any difference right now, as we see it. But still, a situation where the citizens are the people funding the health system is still not acceptable. The government has to come in more, but it's how does government come in? When the distinguished Dr. Olorugbe was the ES of HEFON, we were doing strategic, well, let me call it budgeting. Then government budget had to have a target. What would the budget for this year achieve? Some say, okay, if no intervention, if you put something in the budget and it's not for MDG, it gets knocked out by budget office. But now the budgeting is no commas. It's all commas. They just do, there's nothing to, no target for budget. So we make useless budgets annually. You won't achieve anything, put any amount you want to put there. But the government still needs to put some money. Like we alluded to in the report, either through insurance, people who cannot pay for health insurance, the poor, how can government route the money to pay for their premium? So I think the way we spend the money has to change. The system really needs an overhaul. The way the system is structured now, it will not achieve anything. So it's actually twin devils. Both system cannot make you adequate money of appropriate money of what is in the system, but still the system needs money. So how do we solve that? Thank you very much.
Thank you, Obina. A very good answer. So really, it's about improving governance when it comes to health system delivery. But Senator Olorugbe, we still need money.
Money is also.
We still need money. And I think there's also sometimes from the public side as well, there's a misunderstanding when it comes to budgeting. As a former chief executive of an agency, I know that when I'm told my budget is X, it doesn't necessarily mean X. It just depends on how much is released. So you can make a case for ring fencing the health budget and making sure if the budget is 1.2 trillion, it's 1.2 trillion that will be released because it's always a recurring issue every year. And to me, there's no point in being aspirational when it comes to budgets. We should be able to budget what we can afford. If we cannot afford a budget of 1.2 trillion, there's no point putting it in paper if we know that we can only release a quarter of that. So moving on to, I think I'll come back to Erica. We've got Dayo sitting down there. So Dayo will tell us that viruses evolve and genomes are important, and we've always been told about different variants. We've got Omega. I think we're now starting to run out of the Greek alphabets. Dayo. So, Erica, since we know that viruses evolve, what are the opportunities for sequencing to inform our preparedness given that we have serious resource constraints?
Yeah, it's a question that since the COVID pandemic started, I get asked more often. 3 or 4 years ago when I was talking about, well, we want to set up pathogen sequencing in Ibadan, people were like, what's this esoteric white elephant thing that you want to bring into the country? And now we know that with sequencing, first of all, you can identify pathogens. There was very recently a yellow fever outbreak that would have been missed if it wasn't that they had a complete open way of saying what is the pathogen, even if I have no clue. And sequencing allows you to do that. And then when you have pathogens, COVID is the example, knowing what the variants are informs your response. It also helps you know where the pathogens are coming from. When the pandemic started, we thought that things were going to come directly to us from Wuhan. And when COVID came into the country, it was sequence data that let us know that the route is via Europe, for example. So sequencing is very fine in that it can tell you things about pathogens that you might not obviously see. But I do want to just end by saying that it's not just viruses. Now we're getting sequence data from bacteria that's showing us that we miss many hospital infections in hospitals. You see the same organism in the patient in this bed and this bed. You think they brought it in independently, but sequence will tell you that they actually caught it within the hospital. And as much as sequencing is costly, the cost of not sequencing is even greater. And so these new technologies, just like digitization, are things that we should think about. How can we use them judiciously within our health system? Thanks.
Thank you, Erica. So we'll now move on to the issue of the narrative. Eme, I'm back to you. So the report talks about changing the narrative when it comes to health and looking at public health really from outside the health sector, having a more sort of a multi-sectoral approach. But then health is not the only priority for government. We've got education, we've got security, we've got so many other things. So why must we have health in all sectors?
Thank you. Health definitely is not the main thing, but health is wealth. A healthy person can work effectively. So how do we engage the other sectors, and even for us in health, thinking that, oh, ours is the most important? We talk about poverty, ignorance, and disease. So poverty automatically talks about economy. It talks about getting good jobs. It talks about access, people being trained and being skilled, being capacitated to be able to access the job market. It talks about a provision of jobs. One thing that's very interesting when we travel abroad, you see a lot of young people that have jobs to do. There are industries that can be established in this country that would give access for jobs. Millions of jobs can be developed. For instance, as we came in today, we were picked up by an Innocent bus. I was so excited. Why do we have to import these cars and these buses, when we can make them in this country. Look at the whole issue with the PPEs. There are people in Aba and other places that could make them, and that would provide jobs. Once there are jobs, you would have income for the family. That would ultimately eradicate poverty. So, and then ignorance. Ignorance leads back to education. If our people are well educated, if women have access to education, and we have access to education even in the rural areas, most of us are in our generation, or even our generation and the generations before, there was access to education not too far away. We find that education has become rather elitist in this country. And this is something that, if we're not careful, will come back and bite us in the health sector and in terms of security. It is to our own benefit, and it's to the government's benefit, for us to provide access to education. There was something I was reading recently, that medical education has become elitist. So there are people that came from their villages because they were intelligent enough and they had access to education, they could access medical education. So these are some of the areas. Back to environmental health, environmental engineering, provision of water and sanitation, transportation, rural infrastructure. We can get food in, we can get people moving back and forth and accessing health. So health is a major part of our well-being as human beings, but we have to engage other sectors and also make the other sectors realize that it's to their own benefit that our population is healthy. Thank you.
Thank you, Emi. That's really a very clear statement. Finally, to Obina, last but not least. So Obina, the Lancet report, what makes it really unique is the fact that we have a wide range of people ranging from academia to policy making writing the report. And it was really based on evidence. It had an evidence-based approach. And we know that evidence-based policy decision-making can really enhance the Nigeria health sector. But within your report, you also propose setting up a council, a National Medical Research Council. How would setting up such a council achieve such an enhancement?
Okay, so this is where I'll need the attention of my senior brother, the distinguished Senator Olori in this one. Now, Nigeria is one country. You know, at our level, we don't have any national platform for funding health research. And it showed during COVID. We had to get support from outside. You know, you cannot have a country, all the things we discussed, data systems, evidence-based policy making, and we cannot fund research internally. So that's where the idea of a National Medical Research Council comes in. And I hope this is a low-hanging fruit that we can use to address our national health research priorities. The policy is going to come out soon. So we don't need to depend on external sources, you know, with people looking for funding, which may not align with what we want. I mean, countries that have done very well, countries like, you know, at our level too, including Ghana, but the example I keep using is Thailand. Thailand has a way of funding the generation of evidence routinely. All these things we're talking about, data systems, every year they already have a system and it's funded, and the data is available for decision making. When we talk, people say TED Fund, but TED Fund does not fund other things. But I think for us to move forward, to support the generation of evidence, and then to support with the health system, I think it's a National Medical Research Council is a low-hanging fruit that I hope distinguished Senator Olori will add to about 11 bills that are health bills, because it's really, I mean, it's really very necessary, and we need it right now. Otherwise, we'll keep talking, we'll never generate the evidence we need where we need them. Thank you very much.
Thank you, Obina. So it looks like a lot of the answers have been directed to my distinguished senator friend, Ibrahim Oloripe. So if the rest of us would support me, I would say that I would like to nominate Senator Oloripe to be the champion for this particular Lancet report. Senator Olaribe, you're only allowed to say yes.
Thank you, distinguished panelists and the Lancet commissioners. When I listen to the reports, and with a lot of due respect, most of it are things over the years that we have known. But the last thing you said was one nation, one health. And we often ask, do we have one health in Nigeria, or we have 38 health systems? And that's the question I'm trying to, within all these researches, and I'll come up with some background to the question. Just, I think yesterday, I read the report sent by the Federal Ministry of Health when we asked as part of our oversight for them to provide us report on the performance and implementation of Basic Healthcare Provision Fund. And they wrote, as we speak, there is money released for 2018, 2019, 2020, and 2021. It's only 2018 that has been effectively, say, disbursed. The key thing they said there was that many states are not putting down their counterpart funding. Many states are not meeting the guidelines set up to enable them to get this fund to the health center where it should be. And as somebody that was part of the setup of that fund, I felt very sad because we have money in central bank for 3 years not spent. The one that even was disbursed was not fully utilized. And it's not all states, as we still speak, it's about 33. And nothing can be done because those governors, if they don't, nothing will be done. So when we speak about one health, we speak about more resources to health. We're only referring to one of the 38 components, which is the federal. So the question is, and many countries that you give examples, their political structure and system is different from, but even the Ghana you are talking about, you can talk of one nation, but it's not like that here. How do we, that's my question now, how do we better funded, better managed, and better structure, given our political, or what we call the fiscal structures that we have? How do we navigate that? Because every pressure, everything you write, federal government, when you put up a policy, it will stuck. So that's one of the major challenge, being in this position that I have been and I've seen. The second one, and that also affects even when you talk about more funding. With extra funding, like Basic Healthcare Provision Fund, the insurance that we are trying to talk about, the question will be, these fundings, when they come out of the federal, how does it, still the same thing, how does it get to where it should be? When you talk about primary health care, by virtue of what it is, it's supposed to be the function of the states and local government. But federal government is putting huge resources. They can put more. If they put more, it's still the state. And in answering the question, you have to look at education. I'm sorry to say. I'm speaking much, but I think that is a fundamental thing I want, whether within your research, you are able to look at that. All the functions of each of the level of the government are defined by the Constitution. And I hear my always say, when you bring any law, to say, oh, it's a concurrent list. So the federal government can do, but the state will have to see it as they will just leave. Like Basic Healthcare Provision Fund, I was part of the negotiation with the Governors Forum. When we was the money we are putting for salary and is our contribution. So we are not going to, federal government is now, many of them will now withdraw or they go and be building. So that is what I want to say. But lastly, that's my question, and I want answers to that. What you have said very well, we champion the cause and continue to do. I will be willing, and I'm committing myself to continue to do what I've been doing. Thank you.
So even though I know Obina is our health economics expert and can answer this, but I would like to give the opportunity to Professor Ibrahim Abubakar to because this is something that we have talked about a lot, centralization versus localization and the issue of concurrent responsibilities.
Right, so Honorable Senator, I think the points you made are quite well made, and I think they are correct, that throwing in just more resources towards something that is broken isn't going to fix it if the resources are not well used. In our work, we discussed this extensively, and we've looked at specific new ideas. In the time we have available to articulate for you, we were not able to explain the implementation elements and the innovation around how you make sure that you minimize leakages in the system, how you improve governance, learning from others. Nigeria is not unique. India is like Nigeria with multiple countries, and we do case studies from places like that. There are multiple other states in the world where they have the same challenges, and they have found ways to minimize leakages and to run systems efficiently. So I believe that what we need now is to go beyond this launch and presentation and to sit down with you and talk about each of those issues in detail and articulate the solutions so that you can then, in your position as a legislator, act on those and be able to champion the delivery of them, i.e. the implementation element, and translate the theory that we come together, the examples from other countries, to our unique circumstances as a nation and make them workable. Thank you.
Thank you, Ibrahim. So in your position as legislator, but also in your position as our champion. Thank you. So I do apologize for this has taken a little bit longer than we expected, but I hope the panel discussion was useful. I would like to thank our panelists, all three of them, for your unique insight into this piece of work. And again, I would really strongly recommend that everybody here, including our colleagues, please do read the Lancet paper. A lot of work has gone into it, and it will give you a very good perspective of how we can make our country a better place for our children. Thank you.
Thank you ever so much for that very engaging panel discussion. Our moderator, Dr. Sani Aliyu, Professor Iruka Okeke, Professor Eme Oweje, and of course, Professor Obinna Onwujakwe. Thank you very much for that very engaging question and panel session. I think, in a way, the question and answer session, impromptu as it was, that we had with the distinguished senator, I think helps us also to think of some of the questions we may have asked, and maybe within what they asked, those questions were responded to. So I think we will go on, given the fact that we are a bit over for time, and really welcome some stakeholder remarks very briefly. And we'll start off with Richard Horton, who's the Lancet editor-in-chief. As we mentioned, this preeminent journal has been behind the publication of this report, supported by the UCL team. So we'll start off with some brief stakeholder remarks and continue from there. Thank you.
Well, thank you very much. I hope that you can hear me. Wish I could be with you in person. But distinguished guests, first of all, let me thank the commissioners for the truly excellent work and their final report. This commission has been researched.
Can we please adjust the sound? Thank you.
This commission has been researched and written in full collaboration with key Nigerian health institutions, in addition to leading Nigerian universities, hospitals, and related institutions. And it's an absolute privilege for us to publish this final commission.
We apologize for that. So may I just ask that the sound team readjust and help put the sound out so we can, if we're not able to get Richard Horton, we'll get him back. But in the meantime, just to keep moving on, would I hazard we also go on to Caroline Jehuapia, who's Deputy Director from the Bill and Gates Foundation, given that we're also having her remarks online. Maybe I'll just give the sound team a little bit more time to sort out the sound so that we can actually hear what they're saying, because we really, really want to hear some of their remarks. I'd like to please invite Dr. Walter Kazidemulumbo, the WHO representative, to give your brief remarks, please. Thank you ever so much. And thank you very much for coming, of course.
Dear colleagues and partners, I would like to align with the existing protocol. First of all, thank you so much for inviting WHO to be part of this event, the global launch of the Lancet Nigeria Commission. Very timely, particularly as there is work going on health sector reform. But most importantly, next week we'll be having the Primary Healthcare Summit in Nigeria. So here we have a wealth of evidence to inform those reflections. But above all, it's about repositioning health, not as a consumption good, but as an enabler for economic development. And we've seen the impact of COVID-19 in the economy globally and in Nigeria. I think it's also an opportunity to re-emphasize the place of primary health care as overall roadmap toward universal health coverage. In 2018, we had the Astana Conference and the Astana Declaration, which Nigeria signed off alongside other countries. And you remember there were 3 pillars. The first one was the multi-sectoral policy platform and action, emphasizing the whole of government approach, the whole of society approach. If we are to succeed, we need to realize that health, investing in health is not just a matter of Ministry of Health. It goes beyond Ministry of Health to embrace other sectors of the government, alongside other sectors of the society, including civil society organization, the community we serve themselves. The second component is about putting in place mechanisms for integrated health service delivery, focusing on prevention, particularly with a country like Nigeria with a young population, as was emphasized during the presentation today. And last but not least, is to ensure that the community themselves are empowered to make choices about the health they need and to strengthen the foundation of health system. One nation, one health. When we say one health, it's important that we realize that one health means universal coverage, but also health security, have the other side of the coin. It's very important to invest in health system foundation, to build system that can resist future shock, but it's also at the same time building capacity to respond to shock when they come. And the COVID-19 pandemic has shown that no country was ready. If we don't prepare now, most likely we'll face the same situation when the next pandemic eventually hits. As you know, the pandemic we've been preparing for was not COVID-19 pandemic. It was full pandemic. It's still here to hit. But we have the opportunity to learn from COVID-19 to better prepare for the next pandemic. So congratulations to the member of this commission. This is an excellent piece of work that will certainly help Nigeria do better in terms of reflecting on how to redirect the health system and health security in the country. Thank you again for allowing WHO to be part of this exercise.
Thank you very much, Dr. Mulombo, for your opening remarks. Sorry, for your stakeholder remarks. We always welcome the support of all our partners in the work we do. I'd like to please try and bring on Richard Horton once again. I understand there was some interference when he was trying to give his remarks. Thank you so much, Richard, for joining us again. Apologies for the sound issues.
No, it's great. It's great to be with you, and I hope that this works. But far more important to listen to Ibrahim and the panel than me. But I did want to thank the commissioners for this truly fantastic report. It really has been written and researched with the full collaboration of Nigerian health agencies, in addition to some of the leading Nigerian universities, hospitals, and related institutions. And it's a real privilege for the Lancet to publish this commission. I'd really like to emphasize that the publication is a beginning, not an end. Our work starts today, right now, because our commitment to you is to continue to build and expand our partnership to ensure that the findings of the Commission are acted upon and your recommendations are implemented. We will be asking you to monitor your findings and recommendations over the coming year. And in 1 year's time, we will invite you to review the reception and the reaction to the Commission. But I would also briefly like to say something further at a moment of great global uncertainty, at a time when the coronavirus pandemic is still not yet over, and when a war threatens regional national security in Europe and economic security worldwide. Indeed, I think our world is passing through a dynamic and far-reaching transition, because over the course of the current century, we're going to see shifts in power and influence geopolitically greater and faster than at any time in human history. To a very large extent, demography is our destiny as a species. And the demographic patterns across our planet are undergoing astonishing change. The kind of astonishing change that I'm not sure sometimes our political leaders fully appreciate. By the end of this century, in 2100, according to estimates published by the Institute for Health Metrics and Evaluation in the Lancet in 2020, China's population will contract by almost 50%. The population of Eastern and Central Europe will fall by 2/5. India's population will fall by 1/5, and Western Europe by about 14%. And of course, as you know better than me, the population of Sub-Saharan Africa will increase by 200% to over 3 billion people by 2100. And that means that by the end of this century, more than 1 in 3 people on our planet will be African. Nigeria will lead Africa's population growth, reaching around 790 million people by the end of the century, more than the whole of Western Europe, more than China, more than the United States, and more than the whole of Latin America. And so the opportunity for a transformation in how the world is governed, the institutions, the policies, the programs, leadership and management of regional and global affairs, the economic foundations of our civilization, the changes are going to be enormous and very real. And this is an opportunity that we need to prepare for right now, today. And that's why this commission is much more than a blueprint for a new health system for Nigeria. This commission offers a vision for a nation that in just a few generations will be assuming an unprecedented global leadership role. It's vital to invest in health, and I would add, as you have done, education, in primary care, health facilities, schools, universities, to fully seize the demographic dividend that is here today. And my commitment to you is that the Lancet looks forward very much to working with you in the coming years to realize this incredible moment of history. Thank you very much.
I think we might have, unfortunately, just lost Richard right as he was concluding. We're very grateful to have Richard give some of his remarks given.
I can't really hear you. Can you please confirm if you can hear me? I can't hear you.
You know, the organization that really supported a lot of the work done in this report. So we'd like to please invite Caroline Jehu-Appiah to give her remarks. Thank you.
Thank you, and good evening, everyone. It's already late, so allow me to stand on the already established protocols. So I'm currently in Lagos. I'm really sorry I cannot be with you in person today. Nevertheless, I'm really excited to join you all virtually, you know, to witness the launch of the Lancet Nigeria Commission report. So this journey started in 2019 when the foundation was approached to support this piece of work to produce an impactful analysis to inform the delivery of health goals for the next decade for Nigeria to be disseminated through the Lancet Commission report. And the rationale at that time was that there was no recent report that had synthesized the state of health in Nigeria. And while there were many publications on some elements of Nigeria's health system and disease burden, there was a need for a landmark report to present a comprehensive and critical body of work to provide a framework to reset and shape Nigeria's health agenda for the next decade. So this work began in earnest in 2020, and would like to acknowledge and appreciate the leadership of Professor Ibrahim Abubakar, Dean of UCL, who convened a multidisciplinary group of Nigerian academics in collaboration with global experts and heads of key Nigeria health agencies to put their brainpower together to work on the Lancet Nigeria Commission report. So I'd also like to use this opportunity to thank the health commissioners. So we are all really excited with the product, the publication, which not only provides a historical perspective on the state of health in Nigeria, but also provides insights into the challenges in healthcare delivery and evidence for a framework and new narrative for UHC and the future of health in Nigeria. As a partner to the Nigerian government and people, the Bill and Melinda Gates Foundation has always supported development efforts and is vested in seeing Nigeria leverage its enormous human capital for sustainable economic development. We are thankful for the opportunity to be a part of this landmark report and believe the recently inaugurated Healthcare Reform Committee that the VP spoke about provides an excellent opportunity to translate the work of the Lancet Nigeria Commission report to undertake the necessary healthcare reforms. And as has been said, the most important ingredient is political will. So we join hands with other partners and reaffirm BMGF's commitment to support the government of Nigeria to achieve UHC and improve the lives of Nigerians. Thank you.
And you weren't able to be here in person, but we're really grateful for you joining us, even though we're running a little later than was previously scheduled. Thank you. I'd like to please welcome Kathy Wimp, the Acting Country Director for World Bank, to please also give us your brief remarks. Thank you very much.
Thank you so much. And I'd first of all like to congratulate the authors of this report, because at the World Bank we're in the report writing business. And I can tell you that writing something which is both this comprehensive but also short and crisp and concise, but also sufficiently detailed and charting a concrete way forward, is much, much harder than it looks and takes a long time. So congratulations to you all. At the World Bank, we're very proud to have worked alongside the government of Nigeria tackling health issues for many, many years. We just brought our pretty successful polio project to a close, which supported Nigeria to eradicate wild polio. We've supported the government to implement a number of operations that have used results-based mechanisms to channel funds to the service delivery level at the states. And one of the suggestions I would like to make about how we could help you going forward is that in many, many countries, the health system is structured around central direction but local delivery. And in very few countries do the people doing the delivering work for the central government, which is doing the directing. So how to get the right incentives in that kind of a system is one of the great challenges of running modern public health systems. And in many of the countries where I've worked, central governments use conditional funding or results-based funding to achieve those outcomes. That kind of funding is not a tradition that Nigeria has used in the past, but it's a place where the bank can help to try out these new approaches, which might be a model for how this could be done in the future. So I would also like to end by saying, I think the greatest strength of this report is that it is written by Nigerians for Nigerians, and that's an incredibly powerful thing. We would be very happy to stand beside you to help support where we can to implement this, but I think ultimately what we also hope is that this kind of a report will hasten the day when we've done ourselves out of business, because the kind of health system that Nigerians aspire to and deserve can be financed from your own revenues. So congratulations, and wishing you all the best for the future. Thanks.
Thank you ever so much, Kathy Wim, for your remarks, especially highlighting that this was a Nigerian written report for us Nigerians, which is always great, because we have a responsibility to own our own health sector. So thank you for that. And finally, last but not least at all, I'd like to please invite Dr. Betta Edu, the Honorable Commissioner for Cross River, and also the Nigeria Health Commissioners Forum head. So welcome, and thank you for your remarks too.
Thank you.
Very distinguished Right Honorable Senator Oloribe, and indeed all the very wonderful heads of MDs at the national level. So there's Professor Sambo, Dr. Dyer, and others. I want to very, very respectfully recognize our dear Dr. Chikwe, who is back here with us today. I've not seen you in probably 6 months or 8 months, and Nigeria misses you. Thank you for coming. And then, of course, the wonderful partners that are all seated here, WHO, country representative, World Bank. Let me especially recognize the representative of the Minister for Health, and also Dr. Sani, and indeed everyone in the room. Good evening. I think the time is long spent, and we need to be out of here as soon as possible. First, let me start by saying a very big congratulations to the Lancet Nigerian Commission for the wonderful report. and the wonderful work they have been doing. I can't emphasize how useful this will be as a foundational document to address the challenges that we have in the Nigerian health sector today. Sitting back there and listening to Professor Ibrahim Abubakar, I asked myself some very pertinent questions. What's new? What's different? What have we not heard before? And all I could just tell myself is, maybe we have not done. We have heard, we've discussed, we've said, we've written, but we are yet to do adequate enough to rescue the health system. The SGF was very, very explicit in his speech, and he said, money is not the problem. And I very well agree with him. I make this argument every single day with my colleagues, with everybody else. Money is not the problem. The problem is governance. The problem is strategic planning. The problem is use of data to inform policies. The problem is the infrastructure, is those things which the system on its own should be able to have going before you throw money at it. Like I said, even if you throw $1 trillion into the health system, it won't work until we get the basics right. And really, this report has thrown those points out, and I believe that we will use this as the basis for the Health Reform Committee, which the President has set up. We will use this as the basis for the Primary Healthcare Summit, which is coming up next week. We will use this report as the basis for our interventions going forward, or in fact, an overhaul of the health sector going forward. I want to believe that the right persons are in the room today and they have heard, they've listened to us. I want to believe that everyone is sincerely committed to making reasonable changes that might affect the status quo, but we're ready to make those changes and chart a new course for the health system. I want to believe that with that commitment, both from government, partners, and indeed Nigerians, we can be able to achieve the healthcare system of our dreams. Once again, I want to thank you for this thorough job you've done. I'll really love to get the link so that I can share it with my colleagues immediately and really emphasize on the reason why they need to go through it. I just sat there, I kept reading and reading over and over again, and I think this is truly a reflection of Nigeria for Nigerians. The positive part is that there are opportunities that exist. Those opportunities have been clearly stated, and I believe we'll build and capitalize on that. From all the commissioners for health, we want to say a very great thank you. We are the foot soldiers on ground, and we believe that we can decentralize the healthcare system more and work with the commissioners at the state level to achieve that change in the health system. Thank you once again, and God bless you all.
Thank you very much, Dr. Betta Edu, Honorable Commissioner for Health, Cross River. We'll definitely be sharing the link with you so you can share it with all the other commissioners straight after this, session. Last but not least, I know we're really, really running for time, and I wouldn't want to rush too much this last closing remark, given the distance traveled to give it. I'd like to please welcome Dr. Chikwe Hekwazu, Assistant Director General, Health Emergency Intelligence, WHO, to please come and give us your closing remarks. Thank you very much.
So, thank you, able MC. Anyway, very briefly, we've been through a long day, so it's hard to really think of what to say. But just listening, just working with this group over the past couple of years, I thought about this quote that has been on my mind for many years from Frantz Fanon, that each generation, out of relative obscurity, must discover its mission fulfill it, or betray it. I think we all have to decide on where we will land with that. My experience, my personal experience working with NCDC for 5 years, and my experience working with all the colleagues, my brothers, leaders of the MDAs in the health sector. I hope in the next dispensation we will have some sisters in the group as well. My sister, the Honorable Commissioner for Health, always brings me back hope of what we can be. So the data in this report is stark. And by the time we read it, especially when we compare our performance, not to Europe, but once we compare our performance in this report to countries in West Africa that have a lot less resources than we do, have a much fewer human resources in a way than we do. That really is the challenging part. So if you don't read anything in this report, please read the lines on the front page that says the giant of Africa, Africa's largest country in terms of population and economy, enjoys considerable unrealized potential. The time to achieve greatness is now, with health at the heart of the development agenda. So colleagues, I really want to leave you with these words and thank everyone in this room. Our distinguished senator, who has been on various sides of this struggle from the very early days as an advocate and now in such an important position. The co-commissioners who have really dedicated a lot of time to this. Our colleagues that have worked on the report itself from Lancet, our supporters that have funded some of this work, all of us that have given time to write, to read, to be here, to listen online, who will be engaging with this report moving forward. Thank you for all your work, your determination, your resilience, and your efforts. We will not be the generation that will betray our mission. We can't afford to be. So let's leave here on an optimistic note, reflect on the report, and like was said, this is definitely not the end. This is the beginning. Let's move forward with this work optimistically to build a new future. And really grateful for everyone, to our Minister, Dr. Ms. Alex Oko, His Excellency the Vice President, the Secretary to the Government of the Federation, everyone that has come here today to join us, our distinguished Senator that has stayed to the very end, and of course, my brother and colleague now in WHO, our WR in Nigeria. So thank you, ladies and gentlemen. I think this is a good place to end. Thank you for the excellent team that put this together. Thank you, Nigeria Health Watch, for your work. This has been a great event. Yes, we've run a little bit over, but ultimately, I think the last person I have to thank is my brother, colleague, who has led us on this journey, forced us to give up some of our time, not forced, but encouraged and nudged in his own very special way. Please, ladies and gentlemen, please let's give a round of applause to Professor Ibrahim Abubakar for the work he's done. Thank you very much. So thank you, have a lovely evening. Thank you for coming.
Thank you very much, Dr. Chikwe Hekwazu, for your closing remarks and for thanking everybody. I'd like to just finally say there are dinner vouchers that are being given out as you leave. Please, please, please do take them. We're having dinner in the main restaurant. So please ensure that you grab one before you leave, and don't leave before you've had something to eat. We've kept you here for a long time. Professor Abubakar, would you like to just close this event? Thank you so much.
Thank you very much, everyone. And I just want to say it's been a fantastic event, but I agree the work starts now. And in particular, I'd like to ask Senator Ibrahim Olorogbe and the Commissioner of Health from Cross River State, Beta Edu, that we would like to link up with them and with all the commissioners to take this forward. Thank you, everyone, and have a nice evening.